Welcome to this audio dossier summarizing the article, Costs, Cost Savings, and Effectiveness of a Police-led Pre-arrest Deflection Program, published in the Journal of Multidisciplinary Studies in Human Rights and Science. The Nomad Institute upholds a strong commitment to open science, human dignity, and universal access to knowledge. This study directly contributes to global goals related to health, reducing inequalities, and strengthening institutions. The purpose of this research was to examine the costs, effectiveness, and potential cost savings associated with a police-led pre-arrest deflection program. But what is pre-arrest deflection? It allows police officers to replace an arrest with an immediate referral to treatment. Instead of entering the criminal justice system, individuals are connected directly to a provider specializing in substance use treatment. This approach aims to improve community well-being while allowing officers to use their time more efficiently. This is critical because the United States continues to face a severe opioid crisis. Millions live with substance use disorders, yet the majority do not receive treatment. In response, the Tucson Police Department in Arizona implemented a structured deflection program to reduce reliance on arrest and improve community safety. The study followed 179 individuals. Some were diverted to treatment, and others were arrested for substance-related charges. Researchers conducted follow-ups at 3 and 6 months using multi-level linear growth models to examine changes over time. Regarding illegal substance use, both groups showed improvement. However, individuals diverted by police experienced greater reductions in days of drug use. After 6 months, diverted individuals showed significantly fewer predicted days of drug use compared to individuals who were arrested under similar circumstances. Regarding criminal activity, both approaches reduced the likelihood of committing crimes or being arrested again within the 30 days following the incident. In terms of mental health, symptoms of serious depression and anxiety decreased in both groups as time passed. The study also identified factors predicting better outcomes. First, greater motivation for treatment. At the time of the incident, predicted fewer days of illegal drug use and significant reductions in criminal activity. Second, stable housing strongly predicted better outcomes. Individuals with consistent housing reported substantially fewer days of drug use and lower levels of criminal behavior than those experiencing homelessness. In terms of cost savings and operational efficiency, pre-arrest deflection incidents required considerably less officer time than arrests. This results in direct savings and more efficient allocation of police resources. Furthermore, individuals diverted to treatment spent fewer nights in jail or prison, resulting in substantial cost savings for the justice system. Pre-arrest deflection programs offer a practical, effective, and financially responsible alternative to traditional arrest-based responses. The authors highlight 3 essential components for success. 1. Authentic collaboration among police, treatment providers, and people with lived experience. 2. Robust training for officers, including neurobiology of substance use, motivational interviewing, and reducing stigma. And 3. Operational efficiency, demonstrating that deflection can be faster and less resource-intensive than arrest. In conclusion, pre-arrest deflection is effective, cost-efficient, and aligned with a human-centered approach to public safety. It reduces substance use, lowers criminal activity, improves mental health indicators, and decreases system-wide costs. All statistical models, tables, and methodological details are accessible in the full open access article for independent review. Thank you for listening to this audio dossier from the Nomad Institute. To explore more open access research and human rights-centered scientific work, visit our website and the Journal of Multidisciplinary Studies in Human Rights and Science.